Good morning. The time is 7:32. You're watching Breakfast. You're with Dan Walker and Naga Munchetty.
A reminder of our main news this morning. The breaking news is that the first coronavirus vaccine has been approved for use in the UK by the Medicines and Healthcare Products Regulatory Agency, that's the MRHA. As promised, let's speak now to the Health Secretary, Matt Hancock, who joins us live on Breakfast. A significant smile on your face this morning, Mr Hancock. Talk us through this news and what it means to the people in the UK this morning.
Well, 2020 has been such a terrible year, hasn't it? And help is on its way. And this news, for so long we've been saying that if a vaccine is developed, then things will get better in 2021. And now we can say when this vaccine is rolled out, things will get better, and we'll start that process next week. So I'm obviously absolutely thrilled with the news. I'm very proud that the UK is the first place in the world to have a clinically authorised vaccine ready to go. The huge thanks to the scientists, to Pfizer, the company, obviously to my team and Kate Bingham and Alok Sharma, the business secretary, who's done a huge amount of work on this. But what it means for people is that from next week, we'll be able to start rolling this out. We'll start with those who are most vulnerable to coronavirus, and it will. You need 2 jabs, so 21 days apart. And after that, we will start protecting people as the protection comes with these 2 jabs, and it will help save lives. And then once we've started to and protected the most vulnerable, it will help us all get back to normal and back to all the things that we love.
Can we go through some of the numbers if possible? Because I'm sure that's what our viewers will be thinking this morning. OK, how many, when does it arrive? So there's that initial order of 10 million, which is enough to vaccinate 5 million people. Do we know how many of those will be arriving next week?
Well, next week there'll be 800,000, so it's the first start. We'll then deploy it at the speed that it's manufactured. And the manufacturing, of course, is being done by Pfizer in Belgium. So that will determine the speed at which we can roll it out. As we've said all along, we've always said even if we get something before Christmas, we will have the bulk of the rollout in the new year. And that's what will happen in this case. As you said earlier in the programme, we have 40 million doses on order of this vaccine. The other early vaccine, the AstraZeneca vaccine, is currently being assessed by the MHRA. So the goal will be to vaccinate through the NHS right across the UK as rapidly as the company can manufacture.
OK, I know we've got you for about another 10 minutes, and there are so many questions which I'm sure we're going to try and get as much information out of you as possible as we can. Can I start with that 800,000 that you say will arrive next week? Who will be on the list to get that first batch, if you like?
Well, the Joint Committee on Vaccinations and Immunisations, long title, but they're the clinical advisors who advise on that prioritisation. So it's according to clinical need. The goal is to save as many lives as possible and stop hospitalisations. So it will start with the most elderly and with people in care homes and, of course, their carers to make sure that others don't catch it. And then essentially it comes down the age range. NHS staff are also high on that priority list. And also the clinically extremely vulnerable who we've supported throughout this crisis, those who are particularly vulnerable to coronavirus. The details of that will be set out mid-morning by the JCVI, and the regulators will also be setting out the details of the clinical trials and why they felt able to approve this vaccine. So that'll happen later this morning, and the full prioritisation will be set out. And then the vaccine will be rolled out from next week.
OK, so 800,000 next week. Is it your understanding, Mr Hancock, that all 10 million of those which are going to be manufactured in Belgium, as you said, will arrive before Christmas, or is it going to be a longer process than that?
No, the timing will be determined by how rapidly they can be manufactured. So the numbers, we haven't put a figure on the numbers before Christmas. But what we do know is that we can get started next week with that first load, and then several millions will be coming throughout December. And people will be contacted by the NHS when it's their turn. And I urge you very strongly to come forward, because obviously being vaccinated is good for you. It's approved as clinically safe by the regulator, and it's good for your community as well, to help keep get this virus finally under control once and for all.
We spoke to you, I think, a couple of weeks ago on the day that this was all announced, and we talked then about the huge logistical task that is going to be set before, not just this country, but countries all over the world as we try and vaccinate. Can you give our viewers an idea this morning how exactly it'll work? We know, don't we, it needs to be stored at about -70. So where will this be taking place? Are we looking at specific areas, like maybe those Nightingale hospitals that'll be used? Is it going to be GP surgeries? How will it work?
Yeah, so there's 3 modes of delivery for this vaccine right across the UK. And this morning I spoke to my devolved colleagues because the NHS, of course, is devolved in Wales and Scotland and Northern Ireland. We're doing this on a UK basis right across the entire UK at the same time. And there's 3 modes of delivery. The first is hospitals themselves. And of course, most hospitals have the facilities to store something at -70, and they're used to dealing with vaccines and drugs that have these characteristics. The second is that we will set up vaccination centres, big centres, a bit like the Nightingales project, and including some of the Nightingales, and we'll set them up across the country. And then the third is a community model with the support of GPs and pharmacists and others to be able to get out to people where they are. Now, because of the -70 conditions of this vaccine, that third model is harder, because obviously you have to go to places that have got the facilities that can safely store the vaccine whilst it's waiting to be injected. And that is, the AstraZeneca vaccine, which doesn't have the -70 requirement, is better suited to that community model. But nevertheless, we'll be using these 3 models: hospitals, the vaccination centres, and the community rollout, and in order to reach people, all guided by that clinical priority and the prioritisation that will be set out later today.
You mentioned a couple of those other vaccines. I think it'd be really helpful. Can you give us any idea of the timescale for those? We know that Moderna, which I believe the UK has ordered up to 7 million doses of that. That went forward for regulation the day after Pfizer. So are we to anticipate maybe news on that in the next few days? And what about the AstraZeneca Oxford University vaccine? Where are we on the timescale of that, if you can, Mr. Hancock?
So the Moderna vaccine is only being manufactured for delivery in April. So that's still some time off. As you say, we have 7 million of that on order, but that's for April. The other early vaccine is the Oxford University AstraZeneca vaccine. That's currently with the MHRA, who are assessing the detailed data from those clinical trials in the same way that they've just assessed and authorised the Pfizer vaccine. Now, the AstraZeneca Oxford vaccine has a number of advantages, which is that it doesn't require the -70 storage conditions, and we've got 100 million of that on order. And so the timing of when we might hear on that is entirely in the hands of the regulator. I rightly can't affect that, and I don't know the timing, because they have to take all the time that they need. I mean, they've been absolutely brilliant through that for doing great work, but they have to take the time that they need to assess whether they can authorise that vaccine in the same way that they've taken the time to be able to authorise this Pfizer BioNTech vaccine this morning.
OK, I'm sure you're aware that there have been many people who are listening to you this morning, and this is a game changer for them as well. But the others who'll be thinking, hold on, this normally takes 10 years, it's been done in 10 months, I'm not sure about this. How do you persuade people, not just in this first batch, but over the next few weeks and months, to make sure that this vaccination is something that they do have and can be used for the safety of not only themselves but everyone else.
Yes, well, it's absolutely true that for a vaccine to be authorised by the regulator, it must be clinically safe. And the best way of putting it is that it protects you from the disease, and getting this disease is terrible and can be fatal. And the regulator wouldn't have approved it unless they felt that it was safe, having looked at the data. And this one's been already in the trials in 43,000. The trials of 43,000 people, half of whom had the vaccine, so over 20,000 people. The other thing that I'd say, though, is that don't just listen to me. Listen to the doctors, listen to the nurses, listen to Professor Van Tam, who's the Deputy Chief Medical Officer who's responsible for this programme. As he put it, he phoned up his mum and said, "Mum, if you get the call from the NHS, then go and get vaccinated, because that is what can help protect you from this virus." So it is absolutely right that we should listen to those expert voices, those who've been involved in this programme, and listen to the independent regulator, and they have done the checks, and they know that this is safe and safe to the clinical standards, the high clinical standards that they require.
And finally, Mr. Hancock, I know this might be a tough one to answer, but we heard you speaking powerfully yesterday in the Commons about the loss of your step-grandfather, and please accept our deepest condolences on the loss of a family member for you and the rest of your family as well. I just wondered, people will be watching this morning as well and be thinking, when can we stop worrying about our elderly relatives? When can life get back to normal? Has this news today and the news of vaccines, has that reduced that timescale of when normality can return?
Well, so many families have suffered, and including my own, and I'm just so pleased that 2020 has been just awful, and 2021 is going to be better, and help is on its way. Help is on its way with this vaccine, and we can now say that with certainty rather than with all the caveats that I normally have to put around that. This will take time to roll out. You've got to have that 21 days in between the jabs anyway, and we've got to get this rolled out at the speed at which it could be manufactured. But I'm confident now, with the news today, that from spring, from Easter onwards, things are going to be better. And we're going to have a summer next year that everybody can enjoy. Now, between now and then, we've got to hold our resolve. We passed the new tiering arrangements through the Commons with a big majority last night. People shouldn't just, obey the law. Obviously, they should do that. But let's all respect the restrictions that we have to live our lives in for now to save lives, to protect the NHS this winter, confident, knowing that help is on its way and the dawn is just there on the horizon. So let's get through this together. It's going to be a tough winter still. We've got to get this rolled out. We've got to get it manufactured in large scale. But we all know that if we stick at it, then we'll be through it, difficult winter, through the difficult winter, and from spring onwards, things are going to get better.
Health Secretary, appreciate your time this morning. Thank you.
Thank you very much.
Lots of information coming out from that interview. I was taking copious notes.
No, I saw you
taking copious
away.
notes. So what we understand is the Pfizer BioNTech COVID-19 vaccine has been approved. We are going to talk to an epidemiologist in a moment, but let's just quickly tell you what this means. It involves 2 injections, 21 days apart. So if you're thinking about how quickly it will get out, well, 800,000 of those vaccines will be delivered next week, so says the Health Secretary Matt Hancock. And they will be deployed generally. So when will we get? They've ordered 10 million. So far, 40 million in total. When will we get them? Well, he says it depends on the speed that it's being manufactured by Pfizer. So dependent on that. When it comes to storage, it's being stored at -70 degrees. He says there are going to be 3 modes of delivery. The first, hospitals and most have those delivery and facilities, those facilities for storing it at -70. Then you're looking at vaccination centres, and then you're looking at GPs and pharmacies to get them out to people who can't get to hospitals or GPs. And that is why the government is relying more on the AstraZeneca vaccine, because it's more suited to that model, because it doesn't need that storage level. Ended on an optimistic note, didn't he?
Yeah.
In terms of
said would be
summer,
normal, yeah.
we can enjoy. From spring, Easter onwards, things will get better. Loads more to tell you about throughout the programme. We will keep you updated. Now, let's talk to epidemiologist Professor Sian Griffiths. Good morning. How do you feel?
Good morning.
How do you feel about hearing this?
It's really good news, isn't it? We've been waiting to hear that the vaccines are safe so that we could start the rollout programme. And today we've had that the first vaccine is going to come out of the block. So that I think is fantastic news. And we can sort of breathe a collective sigh of relief that the MRHA found the production of the Pfizer BioNTech vaccine safe, and that we can start to see it used amongst the most vulnerable groups. So it is good news. And as Matt Hancock was saying, we can look forward to a better 2021 than the 2020 we've endured.
Can we talk about the vaccines that have been trialled? So we understand with this one, the efficacy is 95%. We understand we also have the AstraZeneca/Oxford one due, which doesn't need to be stored at -70 degrees. We're also waiting for the Moderna vaccine, which Matt Hancock made clear actually won't be available until April.
And as we work through the population, we'll get more confident, we'll get more experience with the vaccine. And I wouldn't see it as an experiment. We've had vaccines rolled out over the years. Every year, the flu vaccine is slightly different from the last flu vaccine because it has to immunise us against the current strains that are circulating. So people should see this as just one of the routine vaccinations we need this year to get ourselves back into circulation, back seeing our friends and families. But again, as people are emphasising, just don't rush out now, because we do need to stick to the rules until we've got enough people vaccinated. There's enough immunity in the population to protect us against this new and very dangerous disease.
Professor Sian Griffiths, thank you for talking to us at such short notice this morning, epidemiologist there. Thank you.
Get me up.
What did you say?
She said you got me up.
Oh, sorry.
Well, she says you didn't get me up. I missed a bit.
Either way, thank goodness she was up to tell us all of that.
Yeah, that's the news, the breaking news this morning, that the Pfizer-BioNTech vaccine will be rolled out in the UK starting next week. The Health Secretary was live on the programme about 20 minutes ago telling us that 800,000 doses will arrive next week. And then more as it is produced by Pfizer in Belgium.
Very much determined on how it's produced in terms of the deployment of it coming here.
So that's the big news today. It is also in England, where we return back to the tiered system. And one of the changes which is coming into force is that in English football grounds, some league grounds, they're able to have fans back, limited numbers of spectators. It'll be a very different experience to the normal matchday experience. And this is something that Kat is looking at today. And she is at Charlton Athletic.
MK Dons tonight could go second in the table if they win. So they're hoping for plenty of goals here at the Valley for the fans in the stands to cheer. And they are allowed to celebrate. They are allowed to shout and sing as long as they keep their face masks on. Back to you.
OK, good to know. Kat, thank you very much for that. Nice to see what's happening at Charlton today. Stay with us. We've got the headlines coming your way in just a couple of minutes.
Join Nadia Hussein as she explores the vibrancy of American food.
It smells so good.
It's definitely soul food.
And meets the people that love to cook it.
We've kept whatever.